Becoming a mother is one of the most phenomenal events in a woman's life. Nothing gives her more joy than holding a baby in her arms. But for some women, it is a challenging time to become a mother during ongoing outbreak of coronavirus pandemic. Fear, anxiety, and feeling of uncertainty have gripped them during this otherwise happy time, and yet have handled the situation gracefully. We at Medicircle present National Safe Motherhood Day Awareness Series, where we are featuring successful mompreneurs, health professionals, obstetricians and gynecologists, entrepreneurs working on safe motherhood to raise awareness about adequate access to care during pregnancy, childbirth, and postnatal services. Hello, I'm Sana Khan, and today our guest for the talk is Dr. Rohan Palshetkar. Dr. Rohan is a practicing obstetrician and gynecologist and infertility specialist and endoscopic surgeon in Mumbai and Navi Mumbai. He is also a managing committee member of Mumbai OBGY Society, Maharashtra chapter of ISAR, Joint Secretary of AMOGS, Joint Treasurer of MAGE. He has won many awards, including the Asia Oceania Young Gynecologist Award. Please welcome Dr. Rohan. Hello, Dr. Rohan. Welcome to the
Hi,
show.
Sana. Thank
How
you
are
so
you?
much for having me on this program. And I think it's wonderful that you're creating so much awareness regarding safe motherhood, especially in this week, because I think it's very important that we take care of our mothers on a daily basis. And eventually, our aim is to try and reduce the maternal mortality as much as we can.
True, very true. Thank you so much for being here. And we have a few questions for you. And
Absolutely.
to begin with, the six pillars of safe motherhood include family planning, antenatal care, obstetric care, postnatal care, post-abortal care, and control of STI, HIV/AIDS. Dr. Rohan, in your view, how can we ensure safe motherhood?
So, to tackle this problem, firstly, what we need to do is look at each and every point of what you said, the six pillars.
Right.
Now, family planning, I think our government is doing a wonderful job of giving family planning advice to each and every mother that's delivering. We have now the addition of the postpartum IUCD, which allows mothers to have their contraception given to them immediately after delivery, which
Okay.
possibly can even space their pregnancies, which can lead to reduced chances of them having problems such as anemia, problems such as
Right.
short gap between the pregnancies. So
Mhm.
this gives them a control over their contraception but for the woman herself. Secondly, antenatal care with we should be encouraging these mothers to come in for more frequent visits. It was
Right.
initially said that at least a minimum of 3 visits should be done. But
Right.
now we have changed that entire concept and we advise that a woman should come in more often for her antenatal visits, try and see, and we have to triage these mothers into low risk groups as well as high risk groups. Being an infertility specialist myself, I do come across a lot of high risk pregnancies as well. And in fact, that's one thing I specialize in. So for me, I increase the number of antenatal care visits for the pregnant mothers. And again, at our government institutes itself, they are having so many mothers. There are so many NGOs which are coming in the forefront and making sure that these mothers get their prenatal vitamins. The government is providing prenatal iron, folic acid, calcium absolutely
Wow.
free of cost.
Is
So
it?
these are small, yes, absolutely. These are small
Wow.
things which are improving. In fact, I was looking at the maternal mortality rate
Mhm.
from India has been on a decreasing trend. Its rate was 130 per 1 lakh 1 lakh deliveries was the mortality rate in 2014, 2016, which has dropped down to 113 per 1 lakh deliveries.
Wow.
So we can see that the trend is improving, that it is going towards a path where our efforts are showing some results.
True,
So
true,
we
very
are
true.
moving towards this. Now, obstetric care, yes, we are very few doctors with a lot of mothers that are present. But I think through our different societies, in fact, being a part of MOGS and with the parent organization being Foxy, we have this Foxy Manyata program where we're accrediting centers, making sure that these mothers get good quality of care. Also, it also practices safe hygiene practices at the clinics, and there's accreditation being done at regular intervals, so it makes sure that the mothers get good care.
Okay.
Post-abortal care, postnatal care, again with the Foxy Manyata program. I think Manyata Laksha program in Maharashtra, where it's the first private public collaboration for such a program, which is
Mhm.
improving the results in Maharashtra, and slowly we'll be seeing it in India as well.
Okay.
When I look at post-abortal care, I think it's very important that we get to counsel the mothers. It's important to speak to these women, because when we're talking about post-abortal care, we're not talking only about the married women. We're talking about a
Mhm.
younger crowd as well, who may be
True.
unmarried, single women as well.
Right.
So these are women who should be given that option where they are able to speak very openly with the gynecologist,
Right.
and counseling can be given much easier to them.
True.
For the
Very
control
true.
of STI, HIV, AIDS, I think what's very important is that we have all our stakeholders, like our NGOs, like all the
Mhm.
companies which are involved in prevention of AIDS and also the transmission of AIDS. In
Right.
fact, in 2019, when my mother, Dr. Nandita Palshetkar, was the president of Foxy, we had so many tie-ups with NACO in order to create programs, in order to have mission statements done in order to reduce the transmission. And in fact, the government, again, in this situation, is providing a lot of free medical care to pregnant mothers with HIV to prevent transmission to the children. In fact, it can go down
Okay.
to as low as 2% transmission if treatment is given properly and you get a pregnancy and you approach the doctors well within time. So I think these are small steps which we are already taking and already making an effort to improve the safe motherhood in India itself.
That sounds really nice, and I hope it really works well the way we are moving forward. Uh, so, Dr. Rohan, each year in India, roughly 30 million women experience pregnancy and 26 million have a live birth. With an estimated 45,000 deaths per annum, India contributes to a majority of the maternal mortality burden. What are the major causes and how to prevent them?
So, as I said, that yes, we do have a large number of deliveries, because
Right.
of which obviously our maternal mortality rate could be slightly higher, but we
Mhm.
can see that it's on a decreasing trend. That means
Right.
there are efforts being made to do it. Some
True.
of the most common causes is, one is you have hypertension in pregnancy.
Okay.
Then there is something known as postpartum bleeding, where
Right.
after delivery the uterus may not contract, the patients bleed. Third,
Mhm.
maybe inadequate infrastructure at the place where they're delivering. May
Mhm.
they may And again, as I said, triaging them into low risk and high risk. So patients who do have a tendency of high risk should be delivering at a tertiary care center rather than maybe doing home deliveries,
Right.
which, as much as I may say, they are still happening in quite a large numbers
True.
in the villages, in
Rural
the
areas.
interiors of India as well. So
Right.
we have to try and get if the infrastructure can't reach them, at least we have to try and bring them into the cities where there's adequate treatment that can be given to them.
True.
So our main priority is to try and give them the right areas to deliver and also provide them with the adequate nutrition. Anemia is one of the most leading causes of malnourishment in India, and including in our pregnant women as well. This can also lead to a lot of problems during delivery, not just for the mother, but also for the baby itself. So, these mothers, if caught early and treated adequately, can really change the entire scenario. Then, as I said, hypertension, which is one of the most common medical disorders in pregnancy, is another thing which is rampant in India. So, that's another thing where these patients need to consider being delivered at a bigger hospital, tertiary care center, rather than in a village, in a small center, maybe at a government institute where there are all the ICU facilities available, blood banks available, so that they can be treated well within time itself.
So I think,
So I
Dr.
think
Rohan,
these are
we should focus more on the rural part of our country, the rural society, the rural population.
I completely agree. And I can see that the infrastructure is building up, because there
Right.
used to be a time when there used to be no hospitals where you
True,
could
true, very
refer
true.
it to.
Yes.
Now, if I go to look at Maharashtra itself, being the Joint Clinical Secretary of Maharashtra, we've seen the infrastructure developing. I don't think we've reached the point where we can say, yes, we can prevent each and every disaster that can occur. But yes, the mortality rate is decreasing because the infrastructure in the interiors is improving. So we
Mhm.
have to give kudos to our government for improving the infrastructures. Of course, there is room for improvement in terms of blood banks, in terms of ICU availabilities, in terms of basically delivery rooms, in
Right.
terms of ambulances where there can be good referral systems. These are small things which can improve the situation for patients and improve their ability to get good quality care and within good time itself.
Right. Dr. Rohan, women who are pregnant for the first time do not have much knowledge about pregnancy. What are some common ailments associated with pregnancy that they should be aware of, or what they should be knowing?
Absolutely. So the first thing that whenever a woman is pregnant, folic acid supplementation is something that a lot of women are unaware of, that they need to be.
Definitely.
Yeah, exactly. They need to be given folic acid immediately because that's one thing that can prevent defects in the baby itself, neural tube defects
Okay.
in the baby. So this is something that they need to be made aware of, and these are things that are preventable.
Okay.
Secondly, if a patient has excessive vomiting, a lot
Mhm.
of times it's like, okay, in the first 3 months, vomiting is a part of pregnancy, it's taken very lightly. But there's
Right.
something known as excessive vomiting in pregnancy as well, where
Okay.
patients are throwing up almost 10 to 15 times a day, and they're not understanding that it's not a normal thing in pregnancy. At that point, they should be approaching their doctors, getting treated for the same.
Right.
Of course, then there is bleeding in the first 3 months of pregnancy, or rather, bleeding at any point in the pregnancy. It's important that you approach your doctors and meet them.
Hmm.
Anemia, as I said before, also one of the most commonest problems in India, which is creating a major problem in the growth of the baby, as well as during delivery for the mother, as well as post delivery. Remember one thing: with if anemia persists, it can even lead to reduced breastfeeding post delivery.
Oh,
So that
okay.
can affect the growth of the baby after delivery, because the baby is reliant completely on the mother's
Mother's milk.
breast milk for the
Right.
first 6 months.
True.
So these are three common things which you need to be aware of. Of course, there's hypertension and all of these things, but those are problems which can be seen during your routine antenatal care visits when you
Right.
visit your doctor itself.
Hmm. What are some warning signs during pregnancy that a woman should not neglect and immediately report to her gynec?
So one thing is definitely bleeding in any of the trimesters, like in
Right.
any of the 9 months. We divide the 9 months into the first 3 months, the middle 3 months, and the last 3 months. At
Right.
any time if there's bleeding, you must go to your gynecologist immediately,
Okay.
because it can be a variety of issues that could be there. I think it's
Okay.
outside the scope of our interview currently, but that is one thing you must look at. Secondly, if you're having excessive weight gain
Okay.
during your pregnancy, like suddenly in a week you're putting on more than a kg, you
Okay.
must go visit your gynecologist at that point, because that's something could be suggestive of the patient developing hypertension in pregnancy.
Oh,
That's
okay.
another that's one thing, because see, the most ideal way is
So
measure the blood pressure.
this could be a symptom of hypertension.
Yes, so it
Okay.
is one of the signs that when there is an excessive gain, weight gain of more
Mhm.
than 1 kg per week, or about 3 or 4 kgs in a month,
Right.
that time we are a little more careful about looking at the blood pressure. So if you're putting on too much weight, you must just go visit your doctor. Sometimes it could
Right.
just be a factor that you're just having good nourishment, but
True.
should not be taken lightly, because that's something you
Right.
can this. If you're
Mhm.
diagnosed already as a hypertensive patient, you should be looking out for signs such as headache,
Okay.
vomiting, or any abdominal pain that you're having. You
Okay.
must go visit your doctor, because these can lead to more severe complications if not treated in time. Anemia is something that I don't think a patient can diagnose, but I think as a part of the routine antenatal visit, they are tested. So those are things which you don't really have to worry about. Another thing, what I would say is look for any abdominal cramping or any
Okay.
excessive white discharge.
Okay.
Okay, because if there is some excessive white discharge, sometimes it can be a sign of an early delivery.
Oh, okay.
So if there is very heavy white discharge, you must visit your gynecologist or at least inform them that I'm having, so they can have a at least a checkup done. I know during this COVID pandemic time, we do want to reduce the number of visits, but at least if we could get a sonography done to rule it out, that
Correct.
would at least help out, ease the mind of the patient as well as the gynecologist
Mhm.
itself.
Because
So I think
what I know is that what in general people know about this is that white discharge is very normal in pregnancy, but
so.
this
It
is something new, that excessive white discharge is the problem.
Yeah, so it is normal in pregnancy because pregnancy is a progest. There's a lot of progesterone in
Right,
pregnancy, so that can lead to white discharge. Plus, the body is the pregnant woman is very prone to infections as well because
right,
of
right.
the slightly low immunity during pregnancy.
Mm-hmm.
So because of that, yes, there is white discharge. But sometimes if you're having excessive white discharge or having continuous, see, every pregnant woman is going to go to a gynecologist if there is any white discharge.
Right,
But if you're having continuously excessive white discharge, or you're in that situation, you must go to the gynecologist to just get it ruled out, because sometimes you may just take it lightly that, oh, it's white discharge, it's
right.
expected in pregnancy, and you
True.
don't think two ways about it.
Correct.
And then you don't want any consequences which would hamper the treatment of the mother
Very,
as well as
very
the
true.
baby as well.
Right. And I think it would just take one extra visit to the doctor
I
rather
think so.
than
It's
facing
just
any.
something.
True.
Exactly. You don't have to do any invasive procedures or
Right,
anything. It
right.
would just be a regular checkup where the gynecologist would probably do an internal examination to just make sure everything is fine. So I think those are just some few points which every mother should be a little aware of before, while being pregnant, rather.
Right. Okay. India is one of the most high risk places in the world to give birth, accounting for 15% of total maternal deaths worldwide. Every year, 44,000 women die in India due to improper care during pregnancy. As a dedicated healthcare media platform, through this initiative, we hope we were able to educate and aware people about safe motherhood. Thank you so much, Dr. Rohan, for sharing your valuable time and insights and such significant information with our viewers today. It was a pleasure having you on the show.
Thank you so much, Sana. And I'm glad I could impart some new knowledge to all our
Yes,
viewers. Thank you so much,
definitely
Sana.
it was. Thank you so much.